Well, good morning. I'm here from the hills of Tennessee in Leapers Fork, enjoying some time with friends. My name is Philip Kregor. I recently moved to the North Star Trauma Network in Minneapolis, Minnesota with Peter Cole and his team there. And it's a really distinct pleasure and honor to talk with Jim Hughes this morning to give us for Jim to have the opportunity to talk to us a little bit about the early days of the AO, some of the things that he has seen changed and some of the things that he's seen endure, and to give us some of his wisdom in terms of AO education, orthopedic education, life in general. Jim is a real giant in the AO, and I think also is a appropriate hero in terms of a mentor in the AO. He has been on the AO Foundation board. He was the chairman at the University of Mississippi from 1976 until 2012. When I came out of residency in 1993, there were a few giants in AO. You heard the names Ted Hansen, Peter Trafton, Jesse Jupiter, Howard Rosen, and Jim Hughes. And I was fortunate enough after my fellowship to join the faculty there at the University of Mississippi for 6 years, and got to know Jim and his wisdom. And Jim, it's just a real pleasure to be able to talk to you this morning.
Well, thank you so much, Phil, for this marvelous privilege. I really appreciate this opportunity.
Yes. So I thought we could just get started telling us a little bit about where you grew up, how some of the maybe a little things about your family, because I know family has always been extremely important to you, and then maybe move on into where you went to college and how you went to how was it that you went into medical school?
Great. Well, thank you, Phil, for that open door. I grew up in Greer, South Carolina, the second child of a family of 6 children. My dad was a general practitioner, and I guess I touched the medical side by making house call with him in the dark corner of South Carolina, up to where the bootleggers were working out. So it was always a privilege to ride with him in the dark of the night to make house calls and watch him, take care of people with no real thought of recovery of funds, and just submitted himself to take care. During that growing up time, I had the privilege of working in the hot summer of South Carolina, pouring concrete on the roads, and unloading box cars, and working in the grocery store. So I really was, I guess, trained by my parents to really have a zeal for working. And I really appreciate that aspect, to be dedicated in what you're doing. And that kind of came from the foundation of my upbringing. So I'm really grateful for that aspect of it. So I became interested in medicine after college in Mississippi College. I went to medical school. I had a choice between Bowman Gray at Wake Forest and Emory, and where Dad had gone, but I chose Wake Forest because of a contact with a person that I had met that was a graduate there. And so I thoroughly enjoyed the time at Bowman Gray, and really had a thought about going into urology because of a mentor, Jim Glenn, who became the chair at Duke in urology. So when I went to the general surgery residency at Roosevelt Hospital in 60, what was that, 63 to 65, it was with the thought of just going into urology. But there was a lot of orthopedics because it was a general surgery hospital on the west side of New York, and began to obviously participate in all those considerations. And kind of on a humorous note, Phil, there was a doctor named Bill Cassabaum, who was kind of a renegade general surgeon, but very much interested in trauma. And I remember one time, you could say this is the first encounter with the hardware of AO. He couldn't put something together. So he stopped the surgery and went down the street to the horseshoe area and fabricated something and brought it back and put it in the patient and began my first touch, I guess, with the AO, which was rather interesting. But anyway, I enjoyed the time there, and I met a person that was training with Bill Littler, who was hand surgeon. His name was Gaylord Clark, who had finished the residency at Hopkins, and he and I became friends. He had an interest in me, and I remember that, and it'll come into play in just a minute. But from the consideration of the training that I received there in Roosevelt, I went to the U.S. Army and had the wonderful opportunity to spend 1 year in Vietnam as a war trauma surgeon. And during that experience, treating all kind of wounds, both soft tissues as well as the musculoskeletal injuries, I became interested in orthopedics. But the problem was, this was I got discharged from Vietnam in the spring. And in that situation, I had no job come July. And so at that time, I contacted, and I didn't know anybody. I had looked at Hopkins for a residency after, finishing up the medical school, but that was my only contact. But I contacted Gaylord Clark, and he put me in touch with Dr. Robinson, who was chairman of the department at Hopkins, and he graciously gave me an interview. And I'm going to use a term that I'll define too, Phil, that the circumstances in your life, I would say, are divine interventions that you had no control over, but determined or altered your life in a meaningful way. And when I went to visit with Dr. Robinson, I remember sitting in the hall and had an interview with him. And, he said, okay, well, you go back out in the hall and sit, and I'll let you know if you have a job, because it's between you and another guy. So I went back in the corridors of that, sitting in the chair in the hall outside of his office, and that was my fate. What's going to happen? Well, graciously, he came back and said, well, you can have a job. I said, well, thank you, sir. So anyway, I began the Hopkins tour at that moment, when that July. And, there were obviously meaningful people there that really guided me, and it was Lee Riley and others that were on the staff at that time. But another one of these, and the real key for this conversation, Phil, was that Dr. Robinson, in my second year, asked me to come to his office, and he said, Jim, I'd like for you to, he had a little flyer in his hand, and it was a flyer promoting the first AO course in Canada in Winnipeg in January. He said, well, I would like to send you. And I said, well, I don't know what this is, sir, but I'll be willing to go. Well, at that point, obviously at Hopkins, we were hanging people in traction. We were chasing people's femoral fractures, trying to align them, multiple x-rays, et cetera. The normal dynamics of, big casts and no rehabilitation intrinsically. Anyway, I went into the course, Phil, and as I landed in the tundra in January with snow about 5 feet deep, I remember going to the Howard Johnson motel, and across the street, I would walk every morning to the course, and there was Maurice Mueller and Joe Schatzker. And after a couple of lectures, honestly, Phil, I had the deep sense that the light went on in orthopedics. It was really a cataclysmic, enlightening moment to see what you could do with proper reduction, stabilization, and internal fixation, and then immediately rehab. And this was just, it just blew me away, because the sunshine arose on why you're doing what you're doing. Well, I had the privilege of coming back, obviously, for the senior year residency. And I remember the next catalytic moment was that I operated on a distal tibia fracture, and I really felt good because I could put it back together, and it looked good, and I could follow the principles, and then the moment came to try to close the skin. I said, well, wait a minute, this is not coming together. What's the problem here? Because I'd operated obviously in the first day or second day, and had no soft tissue awareness whatsoever. And with that consideration, Phil, I thought, well, I need more training. Something's got to happen to promote my vision of what I can do here, we can do. So with that, I was fortunate enough to get a AO fellowship, and so I went to Basel and then Bern, St. Gallen, and Davos. But the first encounter obviously was with the giants that I began to meet, and I can't list them all, but I had the privilege of working with obviously in there with Villenecker and Bondi in Basel, and then Allgauer also was a principal one. But early in the morning, one day a week, I would get up about 4 o'clock and drive from Basel to Bern and scrub in with Maurice Mueller doing his total joints. So you begin to know the character of these guys by being with them. And, we don't have enough time for the stories that accompanied the character of those individuals. But Phil, they had a collective oneness. They all had a vision of where they were going and how they were going to get there by research, by documentation, by practical application, by having the consideration of the instruments that they needed. And they were all together, though they were individuals, they had this one vision of what could be accomplished. And I would have to say, Phil, that environment was present in Switzerland and Germany at that time. Without that environment of the hospitals allowing them to do what they wanted to do, what they could do, without all the rules and regulations. As you know, the Germanic way is the professor's chief. He does what he wants to do in the hospital within the proper guidance of good medicine. So through that consideration, it was really part of my uh, path in life to see the beauty of the organization, the oneness of what can happen when people work together, and promote good patient care by taking care of all the details and every consideration. So after that year, I had the privilege of coming back on the faculty at Hopkins and begin to carry out some sharings right there. And so
This was about, sorry, this is about 70, 71 or?
yeah, this was 70, right? 70 is when I went to Winnipeg, and I got back in 71 and began the faculty there.
Yeah.
So
So a couple of questions. The first would be when you went to Switzerland and you saw all these giants. I mean, uh, Professor Mueller, Professor Villeneuve, obviously extremely talented individuals. I am told also with quite a bit of confidence. What was it that brought, such talented individuals? I mean, you mentioned it, the oneness, the camaraderie, but what do you think? Was the defining factor that brought these big personalities together so they could stay on the same train together?
I think, Phil, if I had to define it, I would say it was the vision of proper fracture care in a way that had not been done before. So when each of them saw the division individually and communicated it, like, Mueller would talk to Villenecker, would talk to Allgauer. And so as they began to talk with each other, the formation of this giant team, you could say, came together, and they all began to work together. I didn't detect any conflicts at all. It was a harmonious group.
You learn these techniques in Winnipeg, you go back to Hopkins. I must imagine that this was kind of met with some trepidation to think about plating. And then obviously, like all of us, we can get into complications, especially with new techniques. What was that like? And did you know, you obviously bought into it when it sounds like the light bulb went off, as you said, in Winnipeg, but I'm sure some relatively, you know, established professors would think that's a little bit off the beaten path. Is that what you found early on?
Exactly, Phil. There was much resistance. Okay, and I found the same resistance later in Russia. We'll cover that in a minute. But for at Hopkins, it was absolutely, I would say the American orthopedics as a whole was resistance to this change. Because of they saw many of the bad effects of poor metal. So you'd have some metallurgical problems come in, that were corrosion, etc. So they began to not see the beyond that metal problem, but they just thought, well, this is too much. And then, with particularly on forearms, but then I think the paper came out from Memphis from Campbell Clinic that showed that the forearm fractures could be treated this way. So that gradually, incrementally, through the volume of literature and experience, the change came in American orthopedics.
Okay, so you're back on the staff there at Hopkins at about 72, is that correct?
Right, 72 to 76, right.
Perfect. And tell me what you were doing there. What was the AO like? What was fracture teaching like? Did you happen to go to any courses then? And I guess my other question is, we take it for granted if I have a forearm fracture today, all I need to do is pick up the phone and say, I need a small frag set and maybe a mini frag set, but it wasn't so easy then, was it?
No, we only had two, and actually, I think the trays were brought in because the beautiful part about the expression of the wholeness of the Swiss for others was that Walter Bondy came and Billy Necker. I think Billy Necker came to Hopkins and was able to operate. Well, again, Phil, that's a circumstance that I was allotted that privilege to have him in the operating room without a bunch of administrative loops that you had to put in at that time. And
Right.
I watching him and his professorship of handling the soft tissue was just remarkable. I mean, he was a general surgeon, but he certainly understood the fractures and what we were doing. But he also was so careful with soft tissue. So I really enjoyed that aspect of his entrance into our life in AO. The other thing was that we recognized that in order for this to be spread, there would need to be teaching. And I remember the first AO course that I remember was a hand course that basically was started by boiling dog bones in dust, putting them in the back of the car, taking them down, and that was our the bones that we used for the small frag. So, about the time Al Freeland came and began to participate in the hand surgery consideration, now I'm here, but that promoted when Al saw all this, we were able to get him to Mississippi. So then we recognized the need for an AO educational committee. So we started with that and had some marvelous, people on board at that time. Mike Miller was there, and of course, other people were coming in all the time. Here in this realm of where I lived at that time, there was Joe Schatzker and Marvin Tile, Ted Hansen, Jeff Mass, Peter Trafton, Jesse Jupiter. Uh, we all had a similar view uh, in the camaraderie that the Swiss had, that we all wanted to promote the same thing: education, document the results of our work on a daily basis, proper studies. And so that was really a wonderful time to begin to bring North America and Canada into the function of the wholeness of the AO expression.
Hans-Jörg Wyss brought the technology from Switzerland in about what year, or was he really who brought the technology and the plates and the distribution system to North America? And when was that about?
Well, that was, I would say, it's a little bit difficult to answer because they're very interesting. You know, we have to give also put into our remembrances in a positive way Jim Gary, Steve Swartz, and others. And I remember being with Jim Gary when right when Smith Kline French had the rights to the plates and screws in North America, but they didn't want it anymore. So I remember going with Jim to the um, uh, Smith Kline headquarters, and there were a whole bunch of books there. And I said, Jim, can I have these books? They were the original AO manual. So I still got one left to give a prize to some resident somewhere. But but anyway, so it was kind of wiped out. But then Hans-Jörg Wyss obviously came in, and AO began. So the equipment became more available, though no longer you had to hand carry it from place to place.
So that's great. So that was Jim Gary, Steve Swartz, and Hans-Jörg Wyss. Would you say is the original team there, more or
Yeah,
less?
yeah.
Perfect.
Hans-Jörg allowed it, but I would say Jim and Steve were the glue that held all of it together.
Perfect. And so you're at Hopkins. Your practice there is early fracture care, maybe some AO principles there. You also have a general orthopedic practice or sports medicine or
More general and some early joints.
yep. And your joints was obviously you had a great residency training from Johns Hopkins and then also was able to spend time with Maurice Mueller. Is that correct?
Absolutely. Yes.
Perfect. Okay, what brought you to Mississippi? So in 1976, is that right? You moved to Mississippi?
That's an interesting time. It was one of those considerations. I had met a person who was working at the Methodist Rehab Center. He invited us to come down to give a lecture. So I did, and Virginia came. And when I got here, obviously his motive for bringing me was he wanted to recruit me to that area. Well, he invited us, and Virginia and I were taking a couple of days of vacation. So I turned around to Virginia and I said, basically, well, what do you think? She said, why not? So that was the sum total of the discussion to come to Mississippi. Well, that started an interesting consideration, Phil, and that is that when I got here, I went over to the university, which was right next door, building to building, and I told the chairman at that time that I would like to participate with the residents. And I have to be careful how I would phrase the following, but he wasn't so happy about that, but he allowed it. Well, 6 months after that fact, Phil, all the residents at UMC, because of the leadership of that particular person, walked out. They just literally one night walked out. So there was no orthopedics at all, except for the chairman who was there. In that situation, Jim Hardy, who was chairman of the Department of Orthopedics, suggested that I take a look at that because it was such a volatile area. The all the orthopedists in the state of Mississippi held the administration accountable for leaving the professor of orthopedics there for so long and allowing this to happen that they were just demanded that it become a department as it was a division under Hardy. So I told them no, but a couple of weeks later, I just had a quiet time walking in the backyard and I thought, well, why not? Because they had looked at other people and the other people scared them to death. So at age 37, I said, well, okay, I'll give it a go. And so with that situation, there was nothing there. So that was wonderful because there was nothing to to weed out because everything had been gone, had been weeded out. But that started the opportunity and the circumstance over the years. Fraser Ward, my dear colleague, was there and stayed with me during that time. So we began to look for residents And obviously, that was a very difficult situation because most of the residents that we were able to look at had major problems elsewhere. And it was a learning experience that behooves us to have a cup of coffee and talk about later. But there was some,
Because the previous residents had already dispersed, right?
yeah, and they had jobs and they weren't coming back.
So there you are. And so for those who don't know, I mean, I was there in 95 and it was astonishing to me how the university was the flagship and answered the call for a lot of very difficult problems. And I would assume in 76, it's even more so. Would you agree with
Oh,
that?
absolutely. Nobody home to help.
Yeah. And so there you are at 37, 38. You've got a really great clinician and great guy in Fraser Ward. It's yourself. And what do you say to yourself about how you're going to build this? I mean, obviously you've been at a great institution at Hopkins, but we both recognize there's some differences between the University of Mississippi and Hopkins. So what do you say to yourself? And what are some of the basic tenets that you say, I'm going to start building this with the main principles of?
Well, obviously, the core need was trauma care. So, because that's the principle of the University of Mississippi is it is the trauma care center for the state of Mississippi and some in Alabama and some in Louisiana. So I began to look for faculty, and the Al Freeland I had known at Hopkins, and so he said that he would come, but he wanted a year to be trained in hand surgery in Miami. So that was granted. So then he came to be with us. Fraser stayed. Then others began to come in a very real way to help us. And that was Bob McGuire came as a spine surgeon. But overall, you just begin to build faculty. And later, you and George Russell and others came to really uh, bring forth the full release of the quality care. So, the faculty, I guess, was the first orientation that I had. And then you were able to go out and get residents when you were able to provide education for them so that they could pass the boards. I always kidded the residents. I said, if you're a farm boy that can read and write, then you're a good candidate for our residency. So, so there are plenty of those farm boys in Mississippi. So the residents that we have been privileged to have are just absolutely incredible orthopedists now everywhere spread out.
Yeah, I mean, when I reflect back on my time there, a couple of things come to mind, Jim. One was, I mean, I was very privileged to be at a lot of very nice medical centers and great mentors, et cetera. But I never have witnessed such a true sense of family. I mean, you still to this day ask about my son. You gave me a hug the first time I saw you, which I thought was a little bit unusual for a chairman. I remember the first case that I ever did. It was a really difficult T-type acetabular fracture, which happened to be, my real area of passion. And I didn't get it quite right. And I remember like it was yesterday in September of 95, and you walked in the next morning, and I was a little bit distraught because it wasn't perfect in this 21-year-old individual. And you said to me, well, did you try, Phil? And of course, my answer was, well, I did. And he said, well, then you've done all that you can. And so the real sense of family and being a big brother to people, I think was really evident throughout the years. Would you agree that that's one of the biggest attributes of your department?
Yes, Phil, I certainly would agree because we covered for each other. And I would say that's truly caring about each other. Your progress as a most excellent orthopedic surgeon set forth your career. Peter Cole, others that have gone through spent some time with us, added to us. But we, in whatever was picked up from us, then went with you guys as you went out into the world to share your talents with others, both academically and in private practice. So I would say it's a real sense of truly caring about one another, even as we cared about the patients.
Yeah, it's an incredible list. I mean, and I'm sure I'm missing some, but Fraser Ward developed the retrograde intermedullary nail for the humerus and has a lot of really incredible experience in fracture care. George Alonzo went to UAB and then University of South Alabama. Alan Freeland was a giant in hand surgery. Obviously, yourself, Will Geisler, Bob McGuire, past president of the AO Foundation, Peter Cole, George Russell. The list goes on and on. And these people really thrived in that environment. My personal opinion is that you gave them independence to flourish. You gave them unquestionable support, and I think obviously the volume was also in Mississippi because people needed help. What else do you think contributed to the success of so many people?
Well, number one, the administration was again in the environment that we were allowed to function in. They let us, you know, flow in life on a daily basis. We had the ability to manage our funds then, which is not available now. But in managing the funds, we could have the AO scholarships, and we were able to send our young men the third year of their residency or fourth year to various places around the world to train in other AO centers to see what's going on in the general AO world. And that was a real privilege for us to be able to assist in the funding of that. AO Foundation helped some because that was my request that they do so. And so that was just a big contributing factor also of getting quality residents because they could see the breadth of the education they could get.
Yeah, I know resident education was really a key component of the department, obviously. And I can say, as somebody that was just reviewing applications for traumaplasty fellowships up in Minnesota, I know that anybody from the University of Mississippi is really going to be well trained, is going to be confident, is going to be a team player, and is going to act the right way. And I think that's really because of the foundation that um, you gave, and also the example that you gave. I mean, I remember, I think it was 7 a.m. on Thursdays. I may have my day wrong, but you were there. The X-rays were shown, the charts were signed, and it was the consistency of effort that I think really I remember. So, I will tell you that even to this day, the University of Mississippi lives on with your example.
Well, thank you so much. And the one other thing, if we have a few more moments, is just to touch on the wonderful privilege that we all have been given to teach at various courses. And my one of my greatest joys is to have been able to go to Russia for about 30 years, twice a year, perhaps many times, to bring in the Russian speaking world into the AO world. And you mentioned the resistance early on to the AO in America, but I remember one of my first lectures over there, Phil, that because Elizarov was such a strong consideration in Russia, that when I talked about internal fixation, they threw things at me. I remember boots coming by, apples coming by. It was an interesting time. But the beauty and the power of the AO is after about 20 or 30 years, AO is the standard of care. And, you have people like Andrei Volna, Kisilov was there, and others who have been raised up to carry on and also then at Ukraine. And I must say, with great Thanksgiving, I had the privilege of working with Steve Shelkin, who traveled with me quite a bit. And we just had wonderful experiences together throughout Ukraine, particularly in establishing the foundation for care there. And Andre Volna now is working there to assist the trauma surgeons in this difficult time for the Ukrainian people. So you can just see the beauty of the AO spread throughout the world in such a way that whatever circumstances people find themselves in musculoskeletal need, there's potentially an AO person available to assist them in a proper way. So I'm very grateful for that opportunity.
Yeah, I think you got involved with the Russian AO in the late 90s. Is that correct?
I was actually even, uh, yeah, I would say it was the late 90s. Yeah, yeah.
And obviously there, a huge population, really devoid of the AO knowledge. Is that what drew you to Russia, or what was it that you said, I think there's a real need here and I can help?
Well, it in the being on the board at the AO level with the founding fathers enabled us to have those discussions. And so when I can't remember the chicken or the egg, but anyway, it enabled us to start to have the courses over there. And obviously they had to have the instruments over there. And the people from Switzerland would drive across all these borders to get the equipment there, and sometimes they could get it in, and sometimes they couldn't. But it was kind of I would say, a mutual desire of mine, plus the complimentary okay from the administrators and AO.
Perfect. And now it's my understanding it's a thriving AO
Yes,
environment in
it's
Russia.
it's got a little pause right now because of the difficulties with the
Of
nation,
course.
but basically it's still intrinsically inherent within the confines of Russia for sure.
Yeah. That's a wonderful story about Russia, and I know you've done a lot of really good work there. I'd like to pivot just a second, Jim, and kind of have you reflect on what is maybe one of the biggest changes you've seen in medicine, and maybe in parallel with that, what have been some of the consistent themes that you think still are in play today in orthopedics?
Well, thank you, Phil. That's a wonderful question. I would say the changes have really occurred in American medicine in the way administrators handle all dynamics of the hospital environment. Uh, they are very much cost conscious. They are, and because of that, they very much desire to control. So the freedom that we once had that would allow us to develop the use of equipment that we wanted, get it in, get people to come into the OR and help us. That's all changed. Rules and regulations won't allow that. Medical legal comes in as a big picture. What hasn't changed, Bill, is when you are in the operating room with a patient, you have total control. No administrator can come in and alter that. So you bring your compassionate care, your technical skills, and can apply that to the patient who has musculoskeletal problem. And that has remained. Nobody's looking over your shoulder. It may be more problematic to get the patient in, to get the equipment that you need in, but when you are there alone with the patient, to me, that's the most remarkable part of our ability as physicians in medicine is when you close the door to the patient's room or close the door for your outpatient clinic visit. It's just you and the patient, and that's a precious moment that allows us to express our technical skills, our advice, our encouragement, person to person, dynamics of all that the family has gone through with this occasion. And so anyway, just the personal relationship with the patient remains available to us.
Yeah, I think that's a great reflection. When I think as a surgeon, that's why we enjoy being in the operating room so much. We're able to practice the skills that we have learned, that we've been taught by mentors such as yourself, and we're doing it for the good of a patient. And perhaps we are removed for a few hours from the nuances of administrative duties or administrative burdens, and it really it brings us back to the true essence of medicine.
Absolutely.
So Jim, just as kind of concluding remarks, let's pretend I'm a young fracture surgeon. I'm coming out of either residency or fellowship. Um, Maybe give me your thoughts. I mean, I think one of the things we haven't talked about so much is I think there's uh, nobody like you who really practiced the spirit of life balance way before it was talked about. You know, putting family first, putting the way you treat people first, putting patient care first. But what advice would you give the young fracture surgeon or young orthopedic surgeon coming out of residency and fellowship? Obviously, the environment has changed a lot, but I think there are some core values which you've really exhibited in your career, and actually the people at the University of Mississippi have really exhibited in their career. What do you think some of those core pieces of advice you would give the young surgeon?
Well, Phil, that's a wonderful question, and obviously it could um, be answered in many different ways. But I would say, number one, don't think about yourself first. Think about others first. Now, having said that, you have to be careful because, as you well know, as a trauma surgeon, the trauma is 24/7, every minute of every day. So you're never going to solve everybody's musculoskeletal problems, though you might want to and think you can. So there needs to be some governance as to paying attention to, number one, your own health, your own ability to think straight, recognize when you become tired and not thinking straight, to step back, hand the case over to somebody else. Just and then to consider the fact with your family that they are the reason you're doing what you're doing is to provide for them in a proper way. Well, not only are we able to financially take care of them, but we need to take care of them as a proper member of the family, whether it be father, brother, or whatever. So it's really just the scope of your own existence to have it focused on take no thought for yourself, but consider others.
That's perfect. I think that's a really great way to end this, Jim. I've learned once again so much from you. I think that generations to come will really benefit from the wisdom that you've shared today. I think learning a little bit about your past in the AO will also have people know why you truly are one of the giants in orthopedics in the state of Mississippi and in the country, and also one of the giants in the AO. And it's been a real privilege and honor and a fun time to talk to you this morning.
Well, thank you so much for the privilege. I'm just so thankful to be a member of the AO family as a whole. So, and you're a part of that. So, as my dear colleague and brother surgeon, I just say thank you for this privilege and for all those who poured into my life to make this moment possible.
Thank you, Jim. Happy New Year to you and Virginia and all of your family.
Same to you, and may give the greetings to all the Minnesotan people.
I will. Take
Okay.
care.
Bye-bye.